with that being said, I am going to turn this over to Derek. And Derek is a community transition specialist. He is with the Department of Mental Health. He is basically a liaison between ADMH and other state agencies. Uh, Derek is located in Decatur, but works all over the state. He's a speaker, trainer, and has over 10 years of experience with supported employment. I think this is going to be a great presentation today. Um, Derek, so I will let you take it from here unless we have any other questions or comments before we get started.
All right. Well, we'll give
Derek,
it
take it away.
that 2-beat count there for just a minute. Thank you, Kevin. I appreciate that. Ashley, I've been in communication with both of you, and I really appreciate the opportunity to be here today and to be a part of this series. I'm excited about the high level of education that's being exhibited, right? Because assistive technology is it's extremely important to me. I utilize assistive tech every day to complete my job, my career, my work tasks here, but also at home. And so the first thing we want to talk about, though, before, y'all don't really want to know a whole lot about me, let's talk about the important stuff and let's jump into the waivers. So we administer here at the Department of Mental Health 3 different waivers. There are 2 that are considered legacy waivers, and that would be the ID or intellectually developmentally disabled waiver and the LAH living at home waiver. The third waiver is a standalone waiver called the Community Waiver Program, and it's in a demonstration pilot stage right now. We are about 2.5 years into a 5-year demonstration on this. So the difference between the 2 waivers, the older waivers, the legacy waivers, those were waivers that, right, when you go onto the state waiting list for waiver services, those waivers will pull people off as there is availability. And typically, criticality is the main determining factor for individuals being able to receive those services to come off of that waiting list and be able to receive those waiver services. Those include services like, residential providers, community day providers, community experience support employment services for long-term supports. And assistive technology is in that waiver or is in those two waivers. But the one that we're really excited about is the community waiver program. Now, everybody goes onto the same waiting list, regardless of what waiver you're being pulled to. So if you were to register to be on the waiver or apply and be approved to be on the waiver and you move onto the waiting list, right, you might use one of the 3 waivers that we administer, or you might use, let's say, the elderly and disabled waiver that's administered by the area councils on aging. So there are multiple waivers, but there's only one waiver waiting list, and everybody goes on the same thing. Now, the CWP or Community Waiver Program, being the third waiver, the demonstration waiver that we're currently in, is only available in 11 counties. And those 11 counties are Baldwin, Elmore, Houston, Jefferson, Limestone, Madison, Mobile, Montgomery, Morgan, Tuscaloosa, and that last one? Walker, of course, Walker County. So those are the 11 counties. So out of the 67 counties in Alabama, 11 of them for new enrollees, we are only accepting community waiver program. The other 56 counties in the state are still accepting waiver recipients on the traditional or legacy waivers. The idea here is for this to expand slowly. And before we reach our 5-year point, we're hoping to have it expanded to all 67 counties in the state of Alabama, and thereby eliminating new enrollments on the legacy waivers. Now, those who are already on a waiver program, let's say they're on the legacy waivers, they are not going to lose their slot. They're not going to be kicked off. They're not going to have to find another way or reapply or anything. They will just continue to hold that waiver slot and receive those services. And there will be a gradual phase out of the legacy waivers to be replaced by the community waiver program. The community waiver program, as I mentioned earlier, the legacy waivers generally are pulled based off of criticality. The CWP is a little bit different in that criticality is not really a determining factor. I mean, it can be, but it's not the determining factor. So one of the things is, right, when we reach out and do outreach, the idea is to pull more people off the waiting list faster to provide more and better services. The services, as the name indicates, are community-based services. So we see only in extreme cases can a residential service be provided under the CWP. Most of the time, we lean towards living with family or natural supports, or living independently with supports. So that would be the residential side of that. It is a little bit different, and then it's very heavily focused on supported employment services and long-term supports for supported employment, along with more intensive community integration and involvement. So, right, used to, right, we would have a group of individuals or consumers that we serve that would go out in the community, and they would all get, let's say, in an ARC van, and they would all go to the mall and then go to McDonald's for lunch, and that's not the case anymore. With this new, more integrated waiver, we have a smaller staff to client ratio. And so instead of having these larger enclaves or groups, instead we're getting small groups of friends that are integrated in the community, just like any other member of the community would be. So it is taking off, and we're seeing higher success rates for long-term employment success, and higher quality of life being reached, at least overall and generally. Of course, everything has its outliers, but we're really happy with where we are right now at it, and we're trying our best to move as quickly as possible to get folks off that waiting list and onto the community waiver program in those 11 counties. Kevin, can you jump to the next slide for me, please? Thank you, sir.
Nope.
There we go. All right. So what qualifies consumers for AT services? Now, we really, to be qualified for AT services, right, that's funded through us, you have to be qualified for the waiver. So to be qualified for the waiver, there are requirements on that. In the legacy waivers, we're looking for individuals who are 22 years of age or older. We do need a pre and a post aged 18 IQ score. Of course, if that's not gotten, there are workarounds and ways around it. Let's see. And they must be, of course, Medicaid eligible, right? Because you have to have Medicaid to have the Medicaid waiver. That's where funding comes from. For the CWP, there are actually 5 enrollment groups that start as early as 3 years old for early intervention and move up. There's a separate group for transition age high school students, 14 to 21, and then 22 plus is considered adults. So there are services for those age groups that weren't previously served with our waivers. And so we're excited about that. So to be eligible for that, right, you must meet the age requirements. You must meet the requirement of having Medicaid and Medicaid eligibility. The IQ score at this point in time must be a 69 or below to be eligible for waiver services. That is out to be changed. There is an amendment to our waiver currently floating around from CMS, the Centers for Medicare and Medicaid Services, that's awaiting approval. So once that's approved and implemented, we should see an increase in the IQ score that will qualify or disqualify someone for waiver services. Now, once you have your waiver slot, once you're pulled off the waiting list and you're assigned a support coordinator or a case manager, and you receive waiver services, then we go into what's called the person-centered planning process, where we determine what all services someone may need, right? And this is driven by the individual and their families. This is specifically tailored to the needs of the individual that we are serving. And AT, or assistive technology, is included in the services. So if you are eligible for waiver services, you're eligible for the services on the waiver. And that includes assistive technology amongst many, many other services. Now, AT requires an assessment. So an assessment or an evaluation will be done to determine what assistive technology is required. Kevin, do you mind?
Yeah.
One more?
There we go.
Thank you very much, sir. All right. So what's the process for consumers? Right? We've talked a little bit about the eligibility process. And if someone wants to get on the Medicaid waiver, I'll ask one of my amazing cohorts and hosts here to post the following number in the chat. That's 1-800-361-4491. Again, 1-800-361-4491. That's the entry point. That's the starting point for waiver services. So everybody in the state of Alabama goes to the same call center that's located in Montgomery, through that same number. So before any of us at the Department of Mental Health or let's say SAIL with vocational rehabilitation or the area councils on aging can touch anybody on the waiver, they have to go through this process first. That is one of the largest and to be very, very frank with you, most cumbersome points of our waiver application and in the community, in the entire process, right? This is probably going to be the most cumbersome, and it's typical, but it is necessary, right? Because we want to make sure that we're serving those who are eligible, and that if you are eligible for these services, you have the opportunity to receive these services. So once they have that, they'll sit down for the person-centered plan, and then they will decide what we want to do, right? Let's say we want to be in the community 3 days a week, and we want maybe to go to work. We want to do a part-time job. Let's say we want a part-time job for 2 days a week. Right. And so the job of the support coordinator or case manager at that point is to sort of be the hub of the wheel and reach out, then find and create the plan, and then reach out to service providers to try to identify who can fill those gaps to provide those services. So let's see. So the process for consumers, it can be kind of daunting in the beginning, but it's not as bad as it may seem when you first jump in and start, because once the wheels start moving, it's pretty smooth, and a lot of the kinks have been worked out of the process, especially for this new waiver, on getting people enrolled, getting people eligible, then getting people enrolled on the waiver, and then moving them into services as quickly as possible. Let's see. Can you go to the next slide, please, sir? Thank you very much. So what type of AT is eligible through the program? Before I talk about assistive technology, it's important that I differentiate assistive technology from remote supports. So both of those are available through the waiver, to be funded through the waiver. And the most simplistic way to think about this is if you had one faucet of water coming out and two buckets. All right. So with the water representing the money or the funding process, right? You've got assistive technology in one bucket, and that's essentially, for a lack of a better term, that's the stuff, right? That's the assistive tech. That's going to be sensors and computer software or hardware, peripherals like that. The other bucket is the staff, and that is the remote support. So stuff and staff, that's really the easiest way to think about this. And that's, you can utilize some of the assistive technology or some technology that's available to immediately contact natural supports or staff members who can assist professionals and even emergency services. So who can assist with helping our consumers reach their goals. So that's where the support comes in. It is important that we do know and we can differentiate between those two, but they also go hand in hand. So some of the things that we have, and by the way, the possibilities are endless here, right? Anything from electronic technology to hardline technology, like an example of hardline technology might be like something to help someone hold utensils, or a cup holder on a wheelchair. Whereas, right, when we talk about assistive technology, I don't know about y'all, but my mind a lot of times goes to the electronic side. And so I have a screen reader here behind me that I use, a closed caption TV screen reader, on a regular basis. These would be computers, peripherals, like printers and scanners, assistive technology that might be something like cell phones. This might be important, right? A cell phone that's under the waiver has to be prepaid, but it is a cell phone. Some of the most popular items that we see from our providers that are the most requested and evaluated, which just to jump back while I'm thinking about that, the providers do the evaluation. VR also, we can run with the evaluation from the vocational rehabilitation assistive technology engineer, and then from a prescription from a doctor. Those would be the three key places that we would give the recommendations for assistive technology. So while I may, I have a visual impairment, and while I may think that it's perfectly reasonable to ask for a self-driving Tesla because I can't drive anymore, right? It may not be expedient. It might not be qualified, and I doubt I could get a prescription from my doctor for a Tesla. But if that changes, you'll be the first to know. So geocomms are very popular. If you don't know what this is, it's a very small device, like a lifeline type device. It's cellular. It's like a mini cell phone that is on a bracelet or a chain around the neck or something like that, right? And it's a two-way communicator. It can be programmed to contact emergency services, natural supports, staff. It also it runs off of a cellular based system, so it has coverage most anywhere that you are. And one of the most valued aspects of the Geocom is that it has GPS capability. So that GPS capability can help track. This is, can help identify where a location where somebody is. And this is huge for, issues of potential elopement or things like that. We have sensors that go on doors, windows, stoves, that can identify when things are open, when they're closed. And those can be set to send notifications to, again, to natural supports, to staff, even to emergency services. Other sensors, not necessarily cameras, but we do have motion sensors that can pick up motion. So just as an example, we had a young lady living independently here up in the North Alabama region, and we started to identify there were some behavioral issues going on. And this assistive technology was able to identify that she wasn't sleeping at night, right? So she was sleeping about an hour and a half to 2 hours. And so once that was identified, we knew that the behavioral issues were linked to a lack of sleep, but we could have never identified that had we not had the technology to use. So, we would have just still been wondering and creating behavioral plans and trying to figure out ways around it. Once we were able to identify the actual root cause, the doctors were able to help us with something to help her sleep. As she started sleeping better at night, the behaviors disappeared. It was gone. So, let's see. Some of the other things, like I said, software and hardware, assistive technology for visually impaired individuals might include orientation and mobility equipment, right? The canes. Let's see, for individuals who are deaf or hard of hearing, of course, right? We do FM transmitters, which are fantastic, like little radio transmitters that feed to an earbud, so that you can hear what's going on. So the thing about technology is assistive technology that I've run into is that we could spend the next 4 days talking about what assistive technology is out there. The ideas are limitless. So if you are someone who thinks you may need technology, or let's say we have an individual who might benefit from that technology, the best thing to do is to bring in an evaluator. And so once that evaluator comes in, they'll determine what's right and what's wrong. So back to my example of wanting a Tesla, again, while I think it would be super cool that it's a self-driving car and I wouldn't have to rely on a driver, it's not expedient, and it's probably not good to ask, let's say, my assistive technology provider to provide me with a vehicle, right? So the engineer would make the determination, and I doubt very seriously any engineer in the state of Alabama would approve that one. It doesn't mean that it's not beneficial, not helpful. It just means it might not be the best technology to land within the budgets. And that does lead me back to the waivers to say that there is a cap on the legacy waivers for assistive technology of $5,000. There's also a cap on the community waiver program for assistive technology of $5,000. That's why I can't get a Tesla there, Kevin, is because there's not enough money in the budget. But one of the big differences with the CWP is that because we serve so many groups and we start serving at the age of 3 years old, those groupings, so 3 to 13, 14 to 22, and then 22 plus, they have different budgets that they have to work within. And so those budgets will, the support coordination comes out of that budget. Assistive technology would come out of the budget. The other services would come out of that budget. But our assistive technology policy, of course, is to follow the recommendations, the evaluator or the assessor. And then, of course, we train and we can provide, repair, replace, right, even pre-existing assistive technology. Because as we all know, right, technology moves at an accelerated pace. You know, I mean, we're you know, every day new things are coming out, and I'll never forget the first time that I encountered assistive technology when I was in college, getting my undergrad. I didn't have much problems with the first 2 years, but by the time I got to my junior year, I really started to struggle as the eye disease that I have began to progress. And once that progressed and moved up, reading became very painful and very difficult for me. And so I started to fall behind in my reading assignments. And I would experience a lot of physical pain and strain and have to take plenty of breaks. And then I would get frustrated, and my grades began to slip. I had a professor who introduced me to the Office of Student Services at my university, who then made the connection to me with what I like to call the best kept secret in Alabama, and that's the Alabama Department of Rehabilitation Services. And I went to ADRS and applied. I went in and met with the engineer who was from AIDB, and I was a grown man, and I sat in a room and cried and wept because this assistive technology allowed me to read again, and I didn't think it was possible, and I didn't even know it was available. So, so the best thing to do is, if you think there's some sort of assistive technology that can help an individual in their daily lives, regardless of what aspect that is, right? Of course, we're not, you know, in the Jetsons era yet, but we are getting closer day by day. So I encourage you, if you see a problem, work with a provider to see if there's not a solution, because most likely there is. All right, Kevin, if you don't mind, the next slide.
Yeah. Yep.
All right. So, is there a funding limit? Yes, I already talked about that. There's a $5,000 funding cap. Sorry, y'all, I got ahead of myself. A $5,000 funding cap for all three waivers. But I'll tell you, if it's necessary to exceed that funding cap, there's always some form of flexibility, right? It's not something that's heavily advertised, and it's not something that's often utilized or needed. But in cases where it is needed and it can be documented that it's needed, we can be open to discussions about extending that cap.
Gotcha.
So we'll since I did talk about the limit, we'll bump on through the limit and go to the next question that we want to talk about today, which is what is the process or the for the support coordinators and service providers. So once you are on the Medicaid waiver waiting list, you will be identified as a potential recipient, somebody who could benefit from the waiver. You're eligible for the waiver. You're somebody who, you know, that's next to be pulled off of the waiting list. A local waiver coordinator at our DD division offices across the state will pull people for that region and then pass it on to our support coordinators or case managers, who will then reach out to the families and let them know, hey, look, you know, you've been moved onto the waiver off of the waiting list. So we're going to start the process. This is going to have a few evaluations in there that somebody's going to come and they're going to perform. It'll all be done, you know, within just a few hours, but these be evaluations, right? What kind of limitations, barriers, obstacles do we need to overcome? Then our support coordinator case manager will come back with that information and set up a time to meet with the family, the individual served, to develop that person-centered plan, right? And we'll come in and the person-centered plan is a lengthy process because we cover a lot of information. We try to gather in as much in the beginning so there's not any surprises towards later in the year of what an individual might need. And so we begin to devise a plan that's approved by the individual and their families. And then we send that process, or we send that plan, portions of that plan, out to potential providers. So we may have a provider up here. Let's say I'm going to utilize Region 1, just a few examples. The ARC of Madison County up in Huntsville is one of our providers. Okay, and they might provide community experience and residential care, all right, community day habilitation, and even supported employment. But they don't provide assistive technology or remote supports. There is another company or organization that does, and for this reason, they're called Safe in Home. Safe in Home does provide those things. So our support coordinator, case manager, would send out a request to the ARC of Madison to cover, let's say, the community experience where somebody wants to be in the community. But we know assistive technology is going to be there. Our case manager then sends out a request, maybe to Safe in Home, or if there's others who are eligible, to have them respond, hey, we can do this. This is within our capability range. We have the ability, the technology to be able to provide these supports. Then they'll sit down an evaluator who will make a determination and a recommendation over to us, at which point in time, right, those will most likely be approved. Of course, they're reviewed on a case-by-case basis. And then the provider will install and train the individual on the assistive technology. And then they also provide, of course, through some assistive technology, the remote supports that we talked about earlier today. Those same providers are the providers who will provide repairs, right? So you're not just having something shipped to a house where somebody opens a box and, hey, there's some assistive tech in here. No, this goes to the provider, and then the provider physically gets in a car and drives to the location and goes over the equipment and trains on the equipment, and can come down and maintain the equipment, repair the equipment, right? So it really is a very hands-off and non-encumbered situation for our consumers and their families, other than the time to meet with somebody and the time to be trained. But the issue of setting it up, the issue of getting it, and depending on the mail carriers to bring it in to you, those are eliminated, because that all goes to the responsibility of the service providers. And I know I've talked about a few of the services. I should be focusing mainly on assistive tech here, but I'm just wanting to give a few examples to show how this is done. So the support coordinators will follow up. They're kind of your one point of contact. If you have problems, that's who you contact. They'll follow up with you once a month, once every 2 months, just to make sure that things are going okay and nothing needs to be changed. Once that person-centered plan is set and in place, it is not set in stone. It is a living document that can be changed on a regular basis, as many times as we need to change it throughout the year. And then if there's no changes throughout the year, let's say everything's going swimmingly and everyone's happy, then we meet annually to review that person-centered plan. Is it still working? What kind of changes do we have at that point? So that document and that person-centered plan is really, that is the central document. That's the main thing that we're going to have to use as our tool to identify the needs of the individual, and then to identify the providers who are going to provide that service. And then the funding comes from us. So the funding source comes through the Department of Mental Health, funded in with dollars from not just the Centers for Medicaid and Medicare Services, but also state tax dollars. All right, next question. All right, so who provides support in electing and or implementing AT? So again, that's going to go back to our 3 main partners in this that we can accept, and that is going to be a physician's prescription. So a prescription from a doctor. If the doctor sees a need and believes that it's necessary, that they will provide that. Our vocational rehabilitation partners and their evaluators' recommendations, or engineers' recommendations, and then our provider engineers. So the folks that come out and do the assessments and engage with the consumer in their natural environment, with their natural supports, to determine what's best, what's the best fit here, and then maybe what's out there that we don't know about, that might be beneficial. So,
Mhm.
so that is the overall process. And that's definitely who provides that level of
Mhm.
support. All right. Next slide, please. There we go. Oh, look at that. And I've rushed us through it. Are there any questions?
Let me see if there's any questions in the chat. I'm having to,
There weren't any
let's see.
questions that popped up in the chat, but everyone's welcome to still add a question if you have it.
That popped up. Yeah, Kevin is. Yeah, please do. And I know it's a lot of information that's getting thrown out in a really short period of time. So there's nothing like feeling like you've took a sip of water from a fire hose
Derek, we
uh,
did have a
to
question come in.
leave you walking away.
Mhm.
So the question is, who were the three supporting providers that you can accept? The physician, a provider, and
And that would be the vocational rehabilitation engineer. So Voc Rehab, so here's the thing. And I operate, in the world of supported employment. So when we talk about a Voc Rehab engineer, you're probably talking about somebody who's on a path to employment, to competitive integrated employment. And federal law dictates that vocational rehabilitation dollars must be spent before Medicaid dollars can be spent. So if someone comes to us and let's say they want to go to work and we know that assistive technology is going to be necessary, the first thing we do is we bring Voc Rehab to the table, and ADRS starts their process, and they'll work through the employment process, right? Job development, job training, and then job placement. During that period of time, usually the Voc Rehab counselor, and I've never seen one that didn't, was able to identify whether or not we needed to do an evaluation and have a Voc Rehab engineer come in. And so if it's something that Voc Rehab, maybe they're doing the switch over to the long-term dollars, that would be us. Same thing of short-term dollars for Voc Rehab, long-term dollars for us. Once the funding streams begin to switch over from vocational rehabilitation to Department of Mental Health, Medicaid waivers, then we can take also that evaluation from the vocational rehabilitation engineer or evaluator to determine the need for assistive technology. So those are the three. So it's a physician's order, the vocational rehabilitation engineer, assistive tech engineer, and then our community providers.
Mhm. Gotcha. Any other questions for Derek? One of the things too, Derek, that just in my limited experience with assistive technology and Department of Mental Health that may be worth noting is that I've seen cases where consumer or a family may say, well, I can benefit from just say an iPad. There is a very very structured process
There is.
that in agreement with a physician, assuming that gets approved. To your point, the person-centered plan is the driving document
Yes.
that everything comes from. An AT assessment, in my mind, should support whatever goal we're trying to achieve in the person-centered plan. So there has to be, in my mind, a mapping between assistive technology and what goal are you trying to achieve or outcome you're trying to get to. But I would also say that, there are times that, an assistive technology may be performed, but there isn't a good fit and, the outcome would not be achieved with assistive technology. And I think it's a fair point to say, that an AT assessment sometimes can outline where there isn't a remedial benefit for the technology itself. So it's not really purchasing or applying for equipment that doesn't support a goal that's in the person-centered plan. Did
That's
that make
absolutely
sense, or
correct.
did I misstate that?
No. That's absolutely correct. And I will say you're right. There has been some rigidity to it in the past. And what we are seeing is while the legacy waiver assistive technology the process does remain, fairly rigid, there is a little more fluidity and flexibility with the CWP. But to your point, yes, unless it supports the goal, it's probably not going to be approved. I mean, of course, we'd all like new iPads and new iPhones and new Macs or HP computers. But if our end goal isn't supported by that, then it's not. Is it necessary? Right? Is it really something that we need? And so we have to be, right here at the department, just like at Voc Rehab, right? We still have to be fiscally responsible because we are utilizing taxpayer funded services, and we want to make sure that we can serve as many people as possible with the dollars that we have, right? We only have a limited number of dollars, and we've got to serve as many people as we can. So again, if not to just beat the dead horse with it, but if I were to get my Tesla, I'm sure that's $50,000 or $60,000 that could have gone to serve somebody who needed something other than me just having a good time in a self-driving car. So,
Gotcha.
Hey, Derek, we have another question.
Sure.
If someone is on a waiver and working with vocational rehab, and a rehab engineer recommends smart home devices which VR cannot purchase, can Department of Mental Health help with those?
Most likely, yes. Of course, I hate to just jump right out and say yes, but I'm going to jump right out and probably say yes. I mean, with exceptions, yes, with exceptions or limitations. And I can't outline what those would be because it's going to be on a case-by-case basis. But yes, one of the really cool things that we do is the smart home technology. As a matter of fact, we just started a new enabling technology initiative here at the department. Within the past few weeks, I just got the assignment. And so we will be starting assistive technology and remote support conferences throughout the state to educate. And then we're planning on building I think 3 model smart homes where people can come and see the technology and how it operates here in the state. So yes, so so here's the thing, right? Even if they're working with Voc Rehab, if it's outside the scope of Voc Rehab, most likely it's going to be inside the scope of the waiver when it comes to AT.
Gotcha. We had another question that popped up. Let me see if I can get it. There. Okay. Sally's asking, I guess an AAC device for an individual who is nonverbal would qualify under assistive technology. Is that correct?
Yes, that is correct. So that communication device would qualify. Yes. So here's the thing: when it comes to assistive technology, there's more out there than we can probably even go over. Like I said earlier, so there's those items are definitely covered. Yeah. So if it think of it like this, right? If the goal increases the quality of life or participation in the community, or ability to be employed, then yes, it most likely is covered.
Gotcha. The second part of that is, and would there be a particular person who would do the evaluation for that? And what would there also need would they also do the training, or would speech therapists need to do that?
Well, we do have some therapies that cover that. So let's say a speech therapist would come in that's waiver funded if necessary, but most likely it would be the provider who is the most well versed on this particular level of equipment. So that provider would provide the evaluation along with the training and the setup and the support. However, if we did need to bring in someone from a different agency or from a different location to train, generally that's covered. So we've had one case recently that I can think of where we worked with AIDB, who technically is not a provider for our waiver service, but we were able to I think they actually applied and became a provider for our waiver services, and they were able to come in and assist with the implementation of some of the technology that one of our providers was not didn't have the capabilities of providing. So yes, to answer that question, there will be we can bring in additional individuals if necessary. Go ahead. I'm sorry.
No, I just wanted to clarify. So you're saying, this is Jessica, by the way, sorry. So in terms of that person doing the evaluation, I think the question, and maybe Sally can correct me, does it have to be a speech therapist to do the evaluation, or could it be any service provider that that person is working with?
As long as it's a service provider that would be one to provide the assistive technology, then yeah, that's who we would probably use. It probably wouldn't be a speech therapist. Am I still being, am I not following you? Am I being a little bit more
I'm
clear?
from Texas, so that's where I'm just trying to get clarification from me because I just moved out here. So that's where I'm getting clarification for me. Because we
Okay.
would always have, if you're getting funding for those types of devices, you would need to have certain providers do it. So that's where I just wanted clarification. So
Yeah, so we would, and it would be certain approved providers for waiver services. And
gotcha. Okay.
and those providers do have staff that are equipped to be able to make those
Gotcha.
evaluations.
Okay. So it's more of that they're already under that approved vendor list, or not vendor list, but provider list. Okay. That makes sense. Okay.
Yes, and to be an approved provider, they had to hit those benchmarks. So they had to
Gotcha.
have
Okay.
staff that could handle, let's say, the evaluation for the communication device. They would have to have.
Gotcha. Okay.
Yeah.
Okay. Thank you.
Thank you.
Okay, let me see. There's one more message. Melanie's asking, is that this Alabama State vendor list?
Well, is there an Alabama State vendor list? Is that what she's asking?
I
No, are
think
your
so. I'm just gonna-
providers coming from the Alabama State vendor list?
Oh, yeah. So to be one of our providers, they have to be in our state vendor listing. So they have to be registered as a state vendor. I think is our STARS system, and I'm wondering if that's answering the question here. But yes, so that they have to be a registered state vendor, and of course they can be a company from out of state, but they have to be a registered state vendor for the state of Alabama to be considered for a provider. I'm hoping that I'm on the right track here.
You
If I'm
are.
not, please feel free to correct me.
Yeah, she said that is what she was asking.
Cool. Good. Awesome.
Okay.
And I quickly wanted to go back to the smart home technology and whether, that applies to a vocational goal. And in a sense, it really does, because
Absolutely.
that person has to be able to get ready and be prepared to go to work. And so that's part of the process of being work ready, job ready, is being able to manage their independent living as well. So I would say, for as far as smart home technology, it really assists with a lot of those things, and it should be considered even in the vocation process.
Oh, absolutely. And it is it's huge. And there's like I said, I get really excited when I start thinking about it because there's so much out there for the assistive technology. Like I said, it's sensors for doors and windows and bed sensors. So if you've got somebody who might be a fall risk, or who might, be wandering around, one of the coolest things, right? So let's say somebody needs, medication. If they're in a residential program here, we have to have a registered nurse on site to administer that medication. It has to be behind 2 locks, right? So, but we have an automated medication dispenser, right? That's set to dispense medication at a certain time, and so it dispenses that down, and then there's a sensor to make sure that the individual retrieves that. So that if they don't, then the remote supports kick in and they remind them to do that and ensure that that gets done. So all these things sort of work hand in hand. So and that was my point with the remote supports, is that one of the things that I'm really excited about the remote supports with is that it does work hand in hand with the assistive technology to ensure not just the person's highest possible quality of life, but also their safety. Right? Any kind of safety concerns or issues can be really minimized. Of course, we'll never fully eliminate safety concerns and issues, but they could be greatly reduced through the use of remote supports and assistive technology.
Okay.
We do have a
We had a-
follow-up question to that. What if the person lives in a group home and has recommendations for smart home devices?
That's a good question, and I wish I had a concrete answer for you, but I'll give you the answer that we have for the best of our ability. So if it is recommended for the smart home devices, we can work with the group homeowners to try to implement that. What we're seeing here is, with the shift of moving away from group home or group home living situations, residential living situations, is that's beginning to sort of fade away. And so it's becoming sort of a moot issue in the independent living situations, or even a roommate living situation that's independent. we're relying on those smart home supports. But yeah, yes, we have it in the few instances where we have done some smart home supports in residential settings, our group home settings. We've been able to do that without much problem. But yeah, as long as the recommendation's there, as long as the evaluator or the doctor prescribes it, then yeah, we can justify it, and we can work with the group home owners and provider to ensure implementation application.
Yeah. Great.
Again, most of these services, like I said, they're on a case by case, individualized basis. So it is a little more difficult to have generalized answers to specific questions. But but in those specific instances, then yes, the best thing to do would be to contact the case manager and say, hey, we have these recommendations for this smart home stuff, and we want to make sure that gets put on the plan of care.
Okay. Any other questions? I don't see anything in the chat. Any other last questions? If not, then I can turn it over to Ashley. Ashley, if you'll tell us a little bit more about the APT-AT program.
Give me just a
Okay.
second to get switched
Okay.
over. Okay. Well, thank you so much, Derek. That was very informative. I learned a lot. And I knew we would have big interest on the topic because those waivers are very helpful in obtaining assistive technology. So thank you for that. I wanted, before we wrap up, to tell you guys a little bit about our APT-AT program. APT-AT is an evolving program that we are working on. It stands for Accessing Potential Through Assistive Technology. And we are actually a program of the Alabama Department of Rehabilitation Services. So as you heard Derek say, Department of Mental Health works very closely with Department of Rehab Services to provide assistive technology services and vocational services. And we're one of those programs that are underneath ADRS. We're actually federally funded through the Assistive Technology Act. So a lot of the resources that we provide, the activities and services that we provide, are guided by the Assistive Technology Act funding. And those include things like durable medical equipment reuse, providing training to increase knowledge of assistive technology, providing information and resources, and then a short-term loan program, and providing assistive technology demonstrations. So a little bit more information about those programs, those services. The short-term loan library, I think, is one of those services that we really want individuals to know about, especially when they're on those waiver programs, because you want to make sure before you spend funding that has a cap that it is absolutely the technology that is going to benefit you. And our lending library can help you make sure that you're making informed decisions in the technology that you're using your funding for. So our library is available to anyone in the state. You do not have to be enrolled in ADRS services to utilize our lending library, or any of our services actually. And devices can be borrowed for up to 30 days for the purposes of trying before you buy, to make sure that you can make the right decision in the technology that you're going to spend your money on. It can be used as temporary accommodations. So if somebody has a temporary job situation, or they're going on a field trip or some other event that's just short term, they could borrow our assistive technology for that. If you have a device that's going out for repair and that manufacturer is not able to provide you a loaner device in the interim, then hopefully we have something available that you could borrow. And then it can also be used for professional development. So if you're a service provider and you just want to know more about the devices so that you can provide better services to your consumers, then you can borrow the technology just to learn more about it. And Melanie, I do see your question. Do you need to show proof of disability or need? Absolutely not. We do not have any kind of eligibility requirements except that you live in the state of Alabama. Whenever individuals go to our website to request devices to borrow, we do have some questions that we ask before we process the loan. And so when you go to al.atforall.com and you can see our inventory, then you'll be able to request a loan, and then it'll send us a notification that you're requesting devices, and then our staff will contact that individual. And the questions are not about the disability because based on eligibility, but we may ask questions about disability to make sure you're getting the devices that will be the most beneficial to you. Just to get some clarification on the purpose of why the individual is borrowing, because it can be really overwhelming to go through our website and try to find devices. So if an individual can let us know some of the reasons that they plan on using the devices and what their needs are, then we can make sure that they've selected the right devices, and there may be some other devices we want to pair with that to give them the best experience during their trial period. So some examples of things that we have in the library, we do have things like the Watchminder and timers, like the time timer that gives visual cues on time. We do have things that affect positive mental health. That includes these therapy lamps that provide natural sunlight. They mimic natural sunlight, and that is proven to enhance mood and increase energy. And those have been really popular devices in our library, especially if individuals are stuck inside all day, they don't have a window in their office, and they tend to lose energy throughout the day and need that little boost at the end of the day, or with seasonal affect disorder and situations like that where someone faces a little bit more depression during certain times of the year or during the day, those help boost your mood. The voice amplifiers have also been a really popular device in our library. They can be used for individuals with vocal cord damage. They can be used by individuals who are speaking, and maybe they're speaking to individuals who are hard of hearing. So it can be used as an accommodation for your audience, or it could be used as an accommodation for yourself. We also provide demonstrations, and those are a little more in-depth opportunities to learn about the devices that you're interested in. So that is a situation where you will contact us and ask and schedule for a demonstration with one of our AT experts, and you'll have the opportunity to sit down with one of us and actually compare and contrast features of the devices that you're looking at purchasing. And we do have a demonstration center that we just opened here in Homewood. However, we are hoping to work with other organizations across Alabama to make sure that there's access to demonstration centers across the state. So we are working on setting up some partners, and we hope that it'll not be limited to just those who can travel to Birmingham. So some examples of things that individuals could request demonstrations of. The adaptive gaming is a really popular item right now, to give individuals a chance to interact with their peers, even in online gaming. We do have some power assist available. So this is a really cool device called the Firefly that attaches to the front of a manual wheelchair. This is really great for those situations where insurance purchased the manual wheelchair for an individual, but maybe now they're going to college or they're working at a job setting where they have to park really far away from where they actually work, or maybe they have to navigate a big manufacturing facility, and they need that extra power assistance because using a manual wheelchair can be very fatiguing. And so that's something that somebody can come in and we can attach it to their chair and let them try it out and see if it's the device that works well for them. We also have smart home devices that we can demonstrate, and that includes the Roomba. So for example, if someone does maybe have difficulty with communication and they're curious as to whether or not they can activate their Roomba, we can have them come in and we can set up a system, including their communication device, and let them try it out and see how it would work for them to be able to control devices with what they have available. So I wanted to give you a couple of more examples of assistive technology. We do have a lot of computer access devices. We have tons and tons of keyboards and mice. What is pictured here is an individual that's trying a chin mouse. So this would be for somebody who does not have sufficient motor control in hands and arms. They maybe don't want to use speech recognition, and they have good head control. And this is something that's just a joystick, and then when you lean back and forth each way, you can access those switches on each side, which act as your click. And next we have some examples of some technology that individuals were trying when we were at a conference, and we have the Obi robot feeder. So a lot of times that's considered strictly for independent living. However, we also see a benefit even in vocational settings and education settings. So in a school setting, for an individual to be able, for a student to be able to just eat with their peers without an aide sitting next to them might be something they're very interested in, because otherwise they might not be able to engage in that conversation with their peers because there's an adult sitting next to them. So if it's a safe option for an individual to have a robot feeder in that scenario, or even in a job setting where an individual might normally require an aide to feed them, but they're at work and they'd like to be a little more independent, and they have somebody who maybe can set this up for them, and then they could feed themselves independently. And then the device behind her is called a guided hands, and that offers support for individuals who do not have that forearm control or upper mobility strength to be able to move and write and draw and access a keyboard or a tablet that has rails across it that help support your arm. And you can do all kinds of activities with it. We actually set it up to do painting a lot when we are out in the field. And then some other things, we did talk about smart home devices. I really love options for note taking, especially the LiveScribe Smart Pen, which can certainly be used in education and vocation, but also for independent living. If an individual is going to doctor's appointments and then they cannot remember what the doctor told them, because it's very overwhelming to try to remember all the things that are discussed during a doctor's appointment. Well, the LiveScribe Smart Pen can help with that because it records audio as you're handwriting notes. We also have some options for communication and then mobility as well. So we have this folding power chair option too that's been really popular. It's 60 pounds. It's easy to transport for those situations where somebody needs that additional mobility support and cannot use a manual option. So we also do have the DME radialization, and those are available throughout the state. You can find yours in Birmingham, Huntsville, Mobile, Dothan, and Montgomery. They accept donations of durable medical equipment, and then it's available to anyone in the state at no cost. So you just contact that center, see if they have the device you need, and then they'll let you know, and then you can go pick it up. We provide trainings for individuals who would like for their staff or their colleagues to learn more about assistive technology, develop those skills and increase knowledge. And we are doing a rural road show throughout the rest of this year, where we are going to be visiting those non-metro area parts of the state that don't get access to a lot of services. Jessica's going to be hitting the road and bringing some services, some information out to those rural areas. She'll be carrying a mobile library so you can check things out on the spot. We are looking for individuals who would like to help coordinate with that. So if you're interested, let us know. We're a resource in the state for assistive technology information. So if you have a question about whether a device would work for a specific situation or who would be the resource provider for that, contact us, and we hope that we can get you the information that you need. That we can share these slides to everyone who attends on how to access our inventory through AT for All, and then our contact information as well. We hope you will follow us on social media. That's where we have been sharing a lot of the activities that we're doing. So you'll know the webinars that we're hosting and some other information as well. We have AT Alabama that's going to be coming up in October. It's going to be a fun conference so that you can learn more about assistive technology. And we hope to see you all around in the coming year.